Good evening. Good evening and welcome to the Gold Coast virtually. My name is Michael Flynn and I'm one of the doctors at Queensland Fertility Group. I'm specifically based at Gold Coast, but Queensland Fertility Group has got offices all over Queensland and even northern New South Wales. Good evening in what's been a really crazy couple of months, both in the world, but also bringing us back to thinking about the really important things. And since we've been able to do IVF again, and yes, we can, and it's been really exciting last couple of weeks that we've been able to get everything going again and get that vibe going. But it's brought it back down to reminding us what the really important things in life are. I spent a few weeks at home and I did all family things. I spent weeks where I could get up and then at night times we work out what type of movies to watch. And so that basic, simple importance of having a family, in whatever form that family is, because every form is different today, is one of the really basic, important things and what COVID has brought back to us. So, how have we changed and how have we done IVF type things? Because now that we're open. Well, we really are very much the same as all the other companies in that, like Qantas, we've had to adapt. We've had to wipe our seats between passengers. But specifically, we've wanted to change and decrease our risks for both you who are coming to have our services at Queensland Fertility Group, and also for our staff as well. So all the things that we've never really thought of before, and what we're doing tonight, teleconferencing, has almost become the norm. We are able to Zoom and talk to you just like this. I use my laptop exactly as we are now, and I put my laptop as if you were a patient in front of me, and then I have the rest of my office exactly as it is, and we have a lot of consults by Zoom, something I hadn't thought of until just recently. When you're coming in, these days, you come into our rooms and we get our temperatures checked. We know we're not coming in if there's any risk. When we're actually coming in to do procedures today, we're wearing all the protection that you would expect. We're wearing our masks, we're always wearing our gloves. We've modified all of our appointments so that, and modified the way we've done things in the hope that we've evened out every day on a daily basis, so there's not a significant number of patients in the waiting room. You're not going to meet lots of people because we've spaced everything out. We've spaced out our appointments. When we come to do IVF, the one thing you're not going to really like me hearing saying is when we do an egg pickup or we do a procedure, we're testing everyone for COVID. We're making sure that we're in a small room together, that there is no risk. But unfortunately, everyone says to me that COVID testing isn't a nice little thing. What other types of things are we doing? We're still doing all of our normal processes though. So normal IVF, normal stimulated cycles, normal ovulation induction, normal egg freezing, normal embryo transfers, all of our donor services, all of the things on the side we're able to do, like embryo testing, is now all able to be done, but just in a controlled way to decrease everyone's risk. I'd like to welcome especially everyone who might be listening from northern New South Wales. I'm just seeing a little comment on the side. I've heard everything that the COVID testing isn't great. But I've been already called back saying, Catherine's saying, no, it's not too bad. But we are doing COVID testing just pre-egg pickup, just for a safety thing. So we'd like to welcome everyone from northern New South Wales. In our area on the Gold Coast where the borders shut everyone off and we've been cut off between what's our normal neighbours. We normally like to see all of our neighbours from northern New South Wales. So it's been really strange for us that the borders have cut off. So welcome. And I'm hoping to be able to offer all of our services to you as well in the near future. I'm just writing a question down so I don't forget before it goes off, so I'll get back to that. A few little things. Babies and pregnancies. We don't really see that at the present time, where there's no evidence worldwide that there's been any significant risk to pregnancies by COVID and significant risk to babies. So that's one of the reasons we feel safe in being able to offer all of our services again. I just see Renee, thank you very much. It's lovely to get feedback that it works. And I see your baby daughter just turned 1. I'm really very excited about that. Congratulations. So over the last 6 weeks, we still did emergency things. You'd be surprised that there's something called emergency IVF. But unfortunately, we still have to do things like if someone gets their cancer before they start chemotherapy, no matter whether there's a pandemic or not, we're going to do IVF and help maintain fertility preservation in the future. We've still been doing a lot over the last 6 weeks over Zoom, explaining what's your fertility window. What's the best time to get pregnant if we're just trying normally at home? Because I think that's what a lot of people are doing over the last few weeks. What's the best way to optimize your diet? Is there a way of helping eggs get the best energy they can in the hope of increasing our pregnancies? So we've been still doing a lot over the last 6 weeks, but again, we're really excited. A couple of little questions on the side that I keep that I'm seeing as well, and I'm going to answer. And please, you're very, very welcome to put questions out there. I can't answer very individual things, but I'm happy to answer any broad questions from anyone with regards to what Queensland Fertility Group has to offer. One of the things that I see has been in the papers a little bit recently, and there's a question I can see asked just there from Jessica, is what is IV and what's the IV technology trial? At Queensland Fertility Group, and in fact in the group in Australia as a whole, Virtus Fertility, we are very excited about developing, and I'm going to attribute it specifically to the Sydney lab, but we're very excited about the development of using artificial technology, artificial intelligence, to help predict the chances of pregnancy per embryo. So how that occurs is the use of a media or a process called the embryoscope. And the embryoscope is, the embryos are kept in there for 5 days, and via time-lapse photography, fed into an artificial intelligence program that is much smarter than I can ever pretend to be, looks at different attributes that we understand may have an improvement in predicting which embryos have the best chance of pregnancy. While at Virtus and Queensland Fertility Group, we are really excited about this, and we are confident we have got world-leading technology. We're also really cautious that before presenting it to you as a good and viable alternative, it must undergo trials. And those trials are undergoing soon. Not quite yet, but very soon. And when we get the results of those trials, we're very keen to let the public know whether this is a viable technology that we really think it probably will be. So at the present time, it's a watch this space. We're looking at it with interest. We're not telling patients too much about it because we just need evidence before putting it further. Let me just... So I'm just, I'm not I always have difficulty in multitasking, but I'm reading at the same time, which is why I'm wearing glasses today. And there's definitely a few different questions, which are very individual questions, and I can talk my way around without being absolutely specific as to people's discussions. So one of the questions is, does the quality of success factor decline in regards to the length of the time the embryo has been frozen? And the answer is absolutely not. We changed the way we freeze embryos quite a number of years ago to snap freezing or vitrification. And since the process of vitrification, the embryo freezing, your success is frozen in time. So if I'm being very specific, and we've frozen embryo at age 36, and we're putting an embryo back in now, frozen embryo, for your second baby, as I see this question is here, and we're doing it at age 40, the success of the embryo will be the success of age 36. So importantly, not only does the chance of frozen embryo transfer not change or not decrease with increasing time, but it's preserved so that you have the same success rate when you are older. Intrauterine insemination, a question. Yes. We spend a lot of time, and we're very proud of our success with intrauterine insemination. We're also very proud of our donor program, both our egg donor program, sperm donor program, and embryo donor program. Both the ability for women to come up and donate eggs has definitely been difficult since pandemic times. And the ability to access donor sperm has become a little bit more difficult in pandemic times. As you would understand, we get donors from both local Australian donors, and the basic principle of we've all been in lockdown and not being able to move has decreased the ability to access more Australian donors. And with US donors, there's been some type of lockdown, and also the transport between companies has changed. We as clinicians get an update on a number of donors each week, and it doesn't seem to have changed significantly, but I can understand the basics that the donor program has been a little bit more difficult over recent times. I know it's something we're working exceptionally hard on because we value our donor program and our patients who access that donor program very much. The question, which is always a difficult question that I'm seeing here and answering, is what can we do? Can we optimize anything for success for women who are aged over 40? It's a hard question because in the very basics of that, egg age is probably our most important indicator of fertility. But within that, there are little things that can make a difference. There is absolutely no doubt that there's a difference in lifestyle factors. There's absolutely no doubt that optimizing our weight and body mass index. There's absolutely no doubt that you, and I know you know this, is I'm talking to the converted, because if you're really looking at this and you're looking at forums such as we're talking now, you're not out having significant smoking or alcohol every night. You're obviously optimizing your diet. So are there any things? Yep, there are small things that are probably our 1%ers. And here's where it's slightly difficult, because what I'd like to do, especially on a forum like this, is give absolute evidence-based medicine. I don't want to give you any ideas that don't have a whole basis of evidence behind it. But there is a reasonable amount of discussion and work looked into the use of CoQ10, which is the energy source of cells. A lot of older people use it, maybe even me, because there's a discussion that CoQ10 in that energy source decreases the later onset of dementia, that helps brain processes occur. And there's also discussion that it helps increase the energy supply to the egg around ovulation time, and does it improve things? There's a discussion about the use of antioxidants, both for male and female factors around. There's a number of other little things like that, but unfortunately, the aim is to optimize everything, but it comes back to innate egg quality, and that AMH, that test that most people do. If we're a 40-year-old and we have a good AMH and good egg numbers, we probably have a slightly better chance than a 40-year-old who has less egg numbers and less quality. And there's not massive amounts you can do. A question on the side regarding the most difficult process, and what's our access to surrogacy in Queensland. Surrogacy is the ultimate gift that someone can give you. It's probably even better than donating eggs and donating sperm. It is the real gift for someone. In Australia, surrogacy is illegal in a commercial basis. So we have to talk through surrogacy of that there is no money involved apart from reasonable expenses. So in surrogacy, we go through and make sure the surrogates have a significant amount of counselling. They understand all of their rights and responsibilities. It's my responsibility to make sure the surrogate is not put into any extra risk. And when it comes down to it, after all of these factors, at this point in time, there's an external surrogacy committee, so that all those factors are reviewed. And for example, when I would put a proposal to a surrogacy committee, sometimes that comes back and say, have we thought of this test? And that's purely just to make sure that the surrogate is at low risk, so the surrogate's not having increased chance of miscarriage and the risk associated with that. So individually, the reasons for looking at surrogacy is usually between a patient and their doctor, and they're usually very individual reasons, but then they're put to a surrogacy committee, and it is rare for a surrogacy committee to reject it outright, because the clinician and their patient have spent a lot of time together making this decision, but they often have really helpful comments as to how to optimize things. Male infertility. It's a really big factor. And we look with semen analysis at basically three things: exact numbers, the motility and how well they run, and the percentage of normal, what they look like. But all we're really looking is what's our chances of normal fertility. And so the semen analysis has just been described over a large number of men, and we're saying, if this is normal fertility rates, these numbers are what work. So having a semen analysis of numbers less than normal does not in any way say you can't get pregnant. And I've learned in medicine, just never say never. But it means the chances per month are less. And so it goes back to what type of chances you would like to run with. So the question is there anything that can improve infertility factors with low morphology and low motility specifically? And with those questions, again, you go back to initial lifestyle And dietary factors. Smoking makes sperm terrible. Marijuana makes sperm terrible. Significant alcohol makes sperm terrible. The classic factor that's a maybe particularly Gold Coast factor is going to the gym and getting supplements makes sperm terrible. And so there are quite a number of reversible things. Sperm's exciting because it's being made every single day. It's different to eggs, which were made once when you're an embryo, and we're looking after them for the rest of our reproductive life. Sperm is made daily. And so we can influence sperm to some extent. The sperm that's coming out today is a reflection of our health and lifestyle over the past 3 months. In the men who are motivated and everything else is normal, so they're not doing any of those things, there is the discussion again about antioxidants. There's the discussion about CoQ10. There are good commercial products that combine quite a number of antioxidants. There are some testing that can be done to see the sperm chromatin, which is how the DNA works in the sperm. And if the sperm chromatin is really abnormal, there are a couple of techniques to improve sperm chromatin. So sperm definitely is a whole topic of how to optimize it. And it is one of the exciting things because it is one of the ways that can be possibly changed to increase natural fertility. Low-dose aspirin. What do we do with low-dose aspirin? I said before that in a forum such as this, I think what my role is to interpret for you what are the big trials. And in medicine, we would like to run by the trials so that we're not giving you any false hope, false ideas, and you are spending money inappropriately or putting yourself at risk. Aspirin is an interesting one because aspirin is used in a lot of areas in medicine. It's used as secondary prevention in heart attack, and the way it's used there is so that little blood clots don't occur and people don't get heart attacks. In obstetrics, aspirin was found to decrease the chances of a poor outcome in pregnancy in severe preeclampsia, which I'll explain in 1 minute, and severe growth retarded babies. So if we have a very, very small baby or preeclampsia in this pregnancy, there is good evidence to use aspirin in the next pregnancy. And the reasoning behind that is to increase placental function and placental flow. So the thought is, are there other reasons for using aspirin? Does it make any difference with recurrent miscarriage? Unfortunately, in the question we've got here, does it make any difference in late miscarriage? Does it even make difference in implantation failure? And the answer is probably it makes a difference in some of those things. And probably it makes a difference in the question that was asked. But unfortunately, we don't have evidence to say, yes, I guarantee you it makes a difference. And so the next question is are there any risks? And the answer is probably not. But it is definitely a discussion, an individual discussion with your doctor on that one. Question on elective surgery. It was an exciting day today because, and actually I don't know how this is reflected on IVF because I haven't seen any emails or directives on us. But in Queensland, or what we hear, is that the restrictions on all elective surgery has lifted. So long as your places that's happening, your centre, your hospital, is able to provide adequate PPE, personal protective equipment, gloves, masks, etc. So the restrictions we've had on elective surgery or any surgery are probably lifted, provided that the hospital we do it at has all the right equipment. So at the hospital that I specifically work at on the Gold Coast here, we have had excellent service the whole way through. It's been guided really well. In fact, I've got a shout out really to all of our both community and government leaders, because I think we've come through this last 2 months just exceptionally well, and I'm very proud to be Australian at this point. But locally, our hospital's done very well. We've been very strict and stringent about PPE, and I think that does allow us to do all elective surgery. So the question asks, are we allowed to perform endometriosis surgery? At this point in time, absolutely is the answer. A question, is there anything we can do to improve implantation? Yes. Probably the last great frontier of our understandings. When we go through and we seem to get beautiful embryos, and we're putting beautiful embryos in the right spot, and we've even gone further and we've tested these embryos so that we know they're chromosomally normal, and yet there is failure. And that failure, we know there are micromolecular reasons for this, but our understanding is still not spectacular. Is it failure because of immune factors? Well, that must be a significant reason. Is there failure because of other reasons of implantation? And yes, they're there. So again, there's a step-by-step protocol of what we do. But again, you're probably going to find that different doctors end up doing slightly different things because there is no absolute evidence base that this thing works better than that thing in recurrent implantation failure. My feeling with implantation failure is that this will be the great next step forward. And although at the moment we're doing all the little things, and all these little things add up, we don't have the perfect answer of yet. My brief was to be around for about 30 minutes, and I've got to say, I've had a really enjoyable night. Thank you very much for all of the questions on the side. It's almost impossible for me to answer all. So again, I'm Michael Flynn. I work on the Gold Coast at Queensland Fertility Group. There are Queensland Fertility Group offices all up and down Queensland, and I'm confident all the clinicians are able to answer most of the same question. I am happy to talk on Zoom or talk at other times, but I want to thank you very much for being part of my night tonight. I wish you to stay safe in the near future. I hope all of our lives get back to some type of normality, and our dreams of fertility and pregnancy are fulfilled. Thank you very much for tonight.